I'm Dr. Keith Zupnik. I'm an MD, retired from private practice. I'm also a registered environmental health specialist. I'm the project coordinator of the Childhood Lead Poisoning Prevention Program here in Southern Nevada.
Hi, I'm Gail Gholson, and I'm the case manager of the Childhood Lead Poisoning Prevention Program.
Today, we're here to talk about childhood lead poisoning prevention. The Childhood Lead Poisoning Prevention Program is a program whose overarching goal is to eliminate lead poisoning as a public health hazard. Part of the program is to educate people. And by going around and doing demonstrations, whether it's actually screening blood lead, whether it's screening products that may have lead, or just giving out educational materials, we hope to inform the public that we exist.
We're in the phase of screening and testing children by blood, that's a little finger stick, and if they're identified with elevated blood lead levels, we then go and do an environmental investigation, go to their home, and find out where the lead is that they've been exposed to.
Well, an environmental investigation means we have special tools where we can go into a home, we can assess the components of that home for lead-based paint to start off with, since lead-based paint classically is the most common source of lead poisoning. So we can go in and look at the doors, the walls, the ceilings, any structure of the home right on the spot and determine if there is lead present. But it doesn't stop there. What we do is we go on and we look at what the child plays with, what he eats with, what he eats. Anything that we feel might be a factor in creating or causing this child to become lead intoxicated or lead poisoned.
Case management, once the child is identified, involves screening the child and keeping them, watching them until they get to a level that is satisfactory, which is really a 0. Case management will continue, though, if the child has a level of 10, which is the level of concern, until it remains under 10 for at least 6 months. We work with the entire family, and most of the time, in fact, all of the time, they are extremely cooperative in getting the lead out of the child's life.
The reason why children need to be blood lead tested is without blood lead testing, we have no way to definitively know if they've been exposed to lead. And the dangers of lead exposure, unfortunately, lead is a very useful substance in products, but in a human being, it can cause severe and permanent damage or even death.
Elevated lead levels is truly a brain disease. So the lead levels do not easily leave the child's body. They slow down the synapses between the brain cells, which causes the impulses and the thoughts that go from cell to cell through the brain to slow down, usually causing problems.
It's been documented over and over that even small amounts of lead will cause permanent loss of IQ points, and this is how we measure intelligence. It's been shown that children subjected to lead have slower motor reactions when asked to perform the motor skill, and their general cognitive abilities are impaired or limited. And by cognitive abilities mean he can't solve a problem as capable or as quickly as another child who is not exposed to lead. Later in life, we're now knowing that a child exposed to lead might be more prone to Alzheimer's disease. So we're finding out things every day. New research is being turned over, and it doesn't say anything good about the effects of lead. The lead poisoning program primarily focuses on children who are under the age of 6 years old. The way they're exposed is very young children in particular, and even as they're approaching 6, have what we call hand-to-mouth behavior. This means that it's a normal developmental function for a child to be crawling around on the floor, exploring the floor, and then putting his hands in his mouth. It's a way that he, at a very early age, begins to test the environment. So he may ingest lead if it's in the dust on the floor. The other way he may commonly get exposed is if lead was in the air, because even though lead is a metal, it can become very fine in particulates, and it can be inhaled in the air if it's present. But if lead is in a product, we're most concerned if it's in a product that's geared toward children. So if it's in a child's backpack or in a plate that a child eats off of, we would be most concerned. And how does that lead get into that child? very simply is that that lead would have to be what we call leached or extracted by, let's say it's an eating utensil, through the cooking process or through the storage of food process. Lead may present in a variety of symptoms. They may be abdominal symptoms like abdominal pain. It could be constipation or diarrhea. The child may have headaches. He may feel weak and fatigued. But the real thing that one has to be concerned about with lead is it may present with no symptoms whatsoever. And that's the scary thing. And that's why the only way to know if that child has been subjected to lead and if he's ingested that lead or inhaled that lead is to do a blood lead test.
We do lead screening every Wednesday, 1:30 to 4. The entire process takes about 10 minutes. We'll have your results in 3 minutes. You do walk home with the results that we would like for you to turn into your pediatrician. And the cost for that, Medicaid, no charge. The cost for other insurance companies and no Medicaid would be $20. Children should be screened once at 12 months and once again at 24 months. Due to Nevada's very low screening rate, though, we will screen all the way up to 6 years of age.
And one thing I can tell you that is startling, since we know that any level of lead is harmful, we know that approximately anywhere between 18 and 22% of children that we have tested and surveyed already have been exposed to lead, that they have some lead in their blood when they had their blood test, and this is something we need to be concerned about as a community. For more information of our childhood lead poisoning prevention program, please call our hotline or visit our website.